Meghalaya has emerged as the leading state in healthcare budget allocation, dedicating nearly 9% of its overall expenditure to the sector. Chief Minister Conrad K. Sangma, during the inauguration of the Apollo Trinity Medical Centre at Lower Nongrim Hills in Shillong, emphasized the state's commitment to healthcare reforms, including digitizing patient records starting in Riboy district. The state aims to create a digital system for all 38 lakh residents, improving healthcare delivery. Chief Secretary D.P. Walang highlighted the success of the MHIS, which covers OPD services, and called for increased Aadhaar seeding for seamless benefit access. The state is also witnessing significant growth in its healthcare infrastructure with the upcoming Shillong and Tura medical colleges.
Spends more than 8%, almost 9% of our expenditure of our overall budget, our budget is on healthcare, and that makes us the number one in the country to spend the maximum percentage of the budget on healthcare. So this is reflective of the commitment that we have towards health and improvement of the health sector. We are now going to be creating an online system where the entire patient record, OPD, everything will be available to the doctor at any given time. That means the history of the patient.
In Meghalaya, under MHIS, it also covers OPD. So those who come here also, if it is a panel, will be taken care of by the government. My request is that, see, the government is taking care up to 30,000 per annum for OPD. That is up to 30,000 expenditure will be taken care of. The government is giving 30,000 to each and everyone. But you just need to avail a facility, and what is needed basically is that you have to register for the MHIS, Meghalaya Health Insurance Scheme, and you have to have an Aadhaar card.
Union Minister of State for Consumer